We wanted to investigate the influence of rider skill on ridden horse behaviour, assessed using the Ridden Horse Pain Ethogram, and gait quality. The study was performed by myself, S Dyson, in association with Claire Martin from Little University College as her master's thesis, British Horse Society instructor Anne Bondy, who performed the rider and gait quality assessments, and Andrea Ellis from Equine, who performed the statistical analysis. The Ridden Horse Pain Ethogram was developed to facilitate the identification of musculoskeletal pain. It comprises 24 behaviours, the majority of which are at least 10 times more likely to be seen in a horse with musculoskeletal pain than a non-lame horse. The presence of 8 or more behaviours of the Ridden Horse Pain Ethogram is highly likely to reflect the presence of pain. Our objectives were to determine the influence of riders' skill on both ridden horse performance and behaviour, as measured by the Ridden Horse Pain Ethogram. We hypothesised that gait quality at both trot and canter would improve with a more skilled rider compared with a less skilled rider, but the Ridden Horse Pain Ethogram scores would be similar. The study involved 40 horses which were in regular work and presumed by their riders to be non-lame. They were ridden by their normal rider, Rider N, and a skilled professional rider, Rider P, performing a dressage-type test over 8.5 minutes. Rider skill score and gait quality score were each described on a scale of 1 to 10 based on the Fédération Équestre Internationale definitions. The presence of either lameness or gait abnormalities in canter were recorded. The Ridden Horse Pain Ethogram scores were assigned retrospectively to video recordings of the entire test. Rider P had a higher median skill score compared with the normal riders. There was a positive correlation between rider skill scores and gait quality scores. The presence of lameness or gait abnormalities in canter when ridden by riders N and P varied among the horses in a rather unpredictable way. There was no difference in mean or median Ridden Horse Pain Ethogram scores between the N riders and Rider P. However, some specific behaviours changed between the two riders. Find out more about how lameness and canter were different with the two riders and how behaviours changed by reading the full paper. So what significance is this to the clinical situation? Different riders influence the presence or absence of mild lameness or gait abnormalities in canter in an unpredictable way. Although a skilled rider may improve the gait quality of a horse and reduce the degree of lameness, the Ridden Horse Pain Ethogram score may not improve, although the manifestations of different behaviours may change. These observations have important implications at pre-purchase examinations when the purchaser may be a less skilled rider than the vendor, and it may be the vendor that is riding the horse when we perform our examinations. I have many people to thank, but most particularly the generosity of World Horse Welfare for funding the study.